Okay, we are going to be going over 11 of the lower extremity muscles and all of their origins, insertions, and their actions. Starting off with the pectineus. So here's our pectineus, and it's going to originate on the pectineal line of our superior pubic ramus, and then it's going to insert on the pectineal line of our femur. Its actions are going to be hip flexion, hip internal rotation, and hip adduction. Next up is our psoas major. So our psoas major is going to originate on all of the T12 through L5 vertebrae and the discs in between, and then on all of our lumbar vertebrae transverse processes. And then it's going to join with the iliacus muscle, and both of those are going to insert on our lesser trochanter of our femur. Our psoas major is going to be one of our main hip flexors. Adductor magnus. Adductor magnus is going to originate from our inferior pubic ramus over to our ischial tuberosity, and then it's going to insert down the linea aspera on our medial supracondylar line, and then down it's going to skip that adductor hiatus and insert onto the adductor tubercle. Its actions are going to be hip adduction, hip flexion, and hip extension because it's double innervated there. Next up is our gastrocnemius. So our gastrocnemius has two heads. We have our medial head that's going to originate superior to the medial condyle on our femur. The lateral head is going to originate on the lateral side of our lateral femoral condyle, and then both of those are going to insert via the calcaneal tendon to the posterior calcaneal tuberosity. Our gastrocnemius is going to help us with ankle plantar flexion and knee flexion. The popliteus. Our popliteus is going to originate on our lateral femoral epicondyle, and then it's going to insert on our superior to the soleal line on our tibia. And then our popliteus is going to help us with knee flexion, knee internal rotation, and knee external rotation. Our peroneus or fibularis longus. This is going to originate on our fibular head, on our and then on the proximal 2/3 of our fibula, the lateral side, and then it's going to insert down, wrap underneath the foot, and go over to the base of MT1. And then it is going to help us with our plantar flexion because of that way that it inserts on the bottom of the base of MT1, and then it's also going to help us with eversion out to the lateral side. Our gluteus minimus is going to originate between the anterior and inferior gluteal lines on the ilium, and then it's going to insert on the anterior greater trochanter of our femur. It is going to help us with our hip flexion, hip abduction, and hip internal rotation. Obturator internus. This is going to originate on the internal rim of our obturator foramen of our pelvis, and then it is going to insert on the medial surface of our greater trochanter of our femur. This is going to be a hip external rotator and a hip abductor. Quadratus femoris is going to originate on our lateral side or lateral surface of our ischial tuberosity, and then it's going to insert over on the quadrate tubercle of our intertrochanteric crest on our femur. It is going to help us with also hip external rotation, but hip adduction. Biceps femoris, one of our hamstring muscles. It has a long head and a short head. So that long head is going to originate on our ischial tuberosity. The short head is going to originate on our linea aspera and the lateral supracondylar line. And then those are going to join together and insert both of them on the lateral fibular head. Those are going to help us with hip extension, knee flexion, and knee external rotation. Vastus lateralis is one of our quad muscles. It is going to originate on the greater trochanter, on the linea aspera, and on the lateral surface of our femur. And then it is going to insert down on the tibial tuberosity via the quad tendon into the patellar tendon, and it is going to help us with knee extension. And those are all of my 11 muscles to go over with you. Thanks.